for vaccinations for our students 12 years and above. We will continue our pool testing also with our schools. Anything with the vaccine, again, the only thing will be an exemption if it's a religious exemption or a proven medical exemption. Through the authority, not only of executive orders that I can put across, but mainly the authority of the Board of Public Health, which is Commissioner Helen Colton Harris, we are now going to recommend, strongly recommend that as we know, unvaccinated individuals need to wear masks, and and also those that are vaccinated underlying need to wear face covering and/or masks. I am strongly recommending to all city employees to get vaccinated. And if you are not vaccinated, you must wear a mask. I will also move into, if you don't move to get vaccinated, that you're going to have to be tested frequently in order to, again, to protect and preserve our workforce and the public. I've requested all cabinet heads and department heads to give me an updated list of employees on the vaccination rates. We will continue to monitor the numbers, and hopefully the numbers will go in the right direction. If they do not, I will not hesitate in a bit to order vaccinations and other aspects to stop the spread of this Delta variant as a condition of employment. I hope I don't get to that point in time, but I will not be afraid to do that as we move forward. Senior centers will open. And the reasoning here is, again, our senior population has been very, very diligent in getting a shot. Commissioner Helen Colton Harris indicates to me that 65 to 74-year-olds, nearly, it's over 88% have been vaccinated, which gets you that herd immunity. And 75 plus 82%, which is very, very good. The issue here is the younger population, to 18 to 35-year-olds who feel that they are invincible. And I hope and pray they are. But why take the risk? Get the vaccination. When this ordeal, surreal situation started, the average age of being inflicted with COVID-19 was 60 years old. 60. The average age now is 35 years old. So there's been a shift, and that's why we have to hammer away on getting the vaccine. That's extremely important. And we have to continue, please, to the viewing, listening, and reading public, please, do not get your information from social media. Get the facts. Get the facts. Not these wild, concocted conspiracy theories. Conspiracy theories have never stopped medical challenges. Vaccines do. And we can go on and on with polio and all the other medical challenges that we faced before. As far as private businesses, and I see Nancy Creed is here from the Chamber of Commerce, I appreciate that. Again, we asked them, we thank them, again, to the residents and the business community. They've been very understanding and cooperative and patient, that they strongly consider these CDC and DPH requirements. I think some businesses are already doing it, especially people that are unvaccinated, because we just want to try to nip this in the bud. So the major thing here, before I bring up Commissioner Helen Carlton Harris, is get vaccinated. It's proven it works. It'll keep you and your family safe and sound. And the quicker we do that, that will starve any of the variants coming off of COVID-19. They'll have no host to go to. And as far as, again, the moves we're making now, this is to preserve and protect our workforce, the municipal workforce, and also the public. So schools will be in session. They will be masked, students, staff, and teachers. That'll go accordingly with the bus situation. This is in collaboration and consultation with Superintendent Warwick and Chief Nurse Jeannie Clancy. We're going to require, you see the sign in City Hall here, and I just have my mask on. I'm putting it back on, that you're required to wear those masks. And I'm strongly urging or recommending right now that employees, city employees who have not been vaccinated, get vaccinated ASAP. It is very simple. Commissioner Helen Carlton Harris has done a tremendous job. We have neighborhood clinics all over the place that we've partnered with, and we continue to do our own. If you're not vaccinated, you're going to be required to wear that mask. And if you're not at that point in time and the numbers uptick, then I'll move as a condition of employment to review those measures moving forward. With that, that was a basic summation. Let me get you to Commissioner Helen Carlton Harris. She'll be a little more specific. So the last thing I'll say is that we are much better positioned to handle this than we were when we were shadow boxing or flying the plane as we were building it some 15, 16, 17 months ago. And here's the ace in the hole, boys and girls. We have a vaccine, and it works. And I urge you to get vaccinated. That will put an end moving forward to this COVID-19. With that, I'll turn it over to the Commissioner of Health and Human Services, Helen Carlton Harris.
Thank you, Mayor Sarno, and certainly, as always, thank you so much for the support that you've given the city as a whole, and certainly the Department of Health and Human Services. I think most of you are aware that the State Department of Public Health put out an advisory, and it says that the Department of Public Health now advise that a fully vaccinated person should wear a mask or face covering when indoors, and it omits not in your own home. You don't have to do that. Particularly if you have a weakened immune system or if you are at increased risk for severe disease because of your age or an underlying medical condition, or if someone in your household has a weakened immune system, it is advised that you do wear a face covering. There certainly has been a lot of conversation about masks. Masks have been politicized from the right to the left across this nation. Masks face coverings are put in place to save lives. We care about every resident in the city of Springfield and certainly in this nation. And every public health professional in the nation and in the city of Springfield, DPH, CDC's recommendation is that face coverings do save lives. Even individuals who are vaccinated, you can carry the virus in your nose and your mouth and certainly transmit it. And so we are concerned so much about this Delta variant. You're hearing a lot about the Delta variant and the difference between the Delta variant and what we're calling the Alpha variant, which was the first one. This one is much more transmittable. Some scientists say it's 1,000 times more transmittable. What does that mean for us? It means certainly that the risk of transmitting this virus because of the transmittability of the Delta virus is something all of us should be absolutely concerned about. Let me stop there and say no one is trying to be an alarmist. We certainly understand that people are tired, and masks, you thought when you got vaccinated that the guidance would change and we would all go about doing the things that we want to do. I know many of you don't trust the science or the CDC, and many of you don't trust us as messengers. And so it's important that we understand really where we are right now. Education, opportunity, and economics are the 3 points that I want to hit on. Education, if you don't trust the medical community, the scientists, and public health, do your own research. Do your own research. Educate yourself about the Delta variant. Educate yourself about what is going on as far as this COVID-19 is concerned. Combat the misinformation by getting your own information. Look at the history of vaccines in this country, as the mayor has indicated. Think about polio. Think about measles, mumps, and rubella. Think about smallpox. Think about the many viruses and bacteria that have caused havoc in our nation. And then think about the fact that vaccines have been the game changer. We're no longer talking about polio. We're no longer talking about smallpox. And this very same conversation that we're having right now about COVID-19 vaccine, my parents had with scientists many years ago when they mandated polio vaccines. They asked the same questions. Why does my daughter have to get this? But the reality was the science won. We no longer hear about polio. We know how to treat. To your own research, you trust the science and understand that vaccines work. Listen to the trusted people in your life. We did a shot-for-shot clinic a couple of weeks ago at Forest Park. We did surveys with those young people, and we asked them, who do you trust in your life? Overwhelmingly, they told us they trusted their parents. Those who got vaccinated, and there were some who were there, told us when their parents told them they got vaccinated. The other things they talked about was wanting to go back to school full time, and talked about wanting to play sports and wanting to go to college. And so parents, you are so important to this discussion, and I don't want us to leave you out. You are critical. You are the voice. You and parents and guardians are the voice that our young people trust. Please talk to them about the information as far as being vaccinated is concerned, and help them do the research. Vaccinations, individuals vaccinated, please share your vaccination information with those who are unvaccinated. Let them know the process, what you went through, how you feel about it. You can bring others along if you are willing. The other thing that I think is important is that in education, this city is doing a lot of educational work with our partners. We are going door to door. We're knocking on doors. We're doing everything that we can to get people to understand the importance of vaccination. There is opportunity. The opportunity is that we have developed a very comprehensive community-based vaccine program and strategy. Vaccines are available, and let me tell you some of our partners, which are unusual partners for some of us. Of course, Health and Human Services, we're still doing our weekly clinics. BHN, Behavioral Health Network, New North Citizens Council, Bay State, Mercy Medical Center, Tapestry, Big Y, the Pride Gas Station, STCC, among others, are doing vaccine clinics because they understand the importance of getting individuals vaccinated. And so there are vaccine opportunities available, and you can go to mass.gov/vaccines or mass.gov vaccine availability, or you can go to the city's website. Plenty of vaccine opportunities out there. And so please There is no reason why an individual cannot find a vaccine in the city of Springfield. The other thing about vaccines we know, we heard a lot about breakthrough infections. And so what's interesting is that we never said, or scientists never said to us, that COVID-19 was that vaccines were going to prevent COVID-19, but rather said that getting a vaccine is going to prevent death and severe disease, and that is happening. And so when we hear about these breakthrough infections, many individuals don't like that term because it makes it seem as if it's broken through the vaccine, which is not true. The vaccine is holding and doing what scientists told us it would do: prevent death and severe disease. Economics. The business community must be engaged with us in developing strategies to reduce COVID-19 infection. And so we are asking, as the mayor has said, the business community to think about this with us and think about your role and responsibility as far as this virus is concerned and taking care of each other. Because I know everyone in the business community wants their employees to be healthy. They want to take care of their employees, and they want to keep the economics of their business going. And how do we do that? We do that by making sure individuals are vaccinated and or wearing face coverings. There's been a lot has been talked about in the media, and the reason we are here is not to be an alarmist. The mayor and I are not here to raise suspicions and say to folks, you know, we want to make you afraid. We want to create fear. What we want to do is help you create strategies in order to remain healthy, and that is the reason why we are doing this update. In the city of Springfield, we're watching our numbers increase. We're watching our numbers increase from a low of 17 5 weeks ago to now 122 this last week. So what that means is that our numbers are increasing, and we are not sounding an alarm, but we're simply saying we see our numbers increase. We know the impact it's going to have on the community. We know that it could result death and devastation. We also know across this nation that younger people are getting sicker and winding up in the hospital. So as the mayor said, the average age of COVID infection is somewhere around 35, when it was 60 when we began this journey around COVID-19. Younger ages being impacted, younger ages being hospitalized, younger ages dying from this virus. The other thing I would say, though, although Massachusetts' numbers are low, let's be clear. We live in a country where people travel from state to state. We know that many individuals in Springfield and Massachusetts are hosting individuals from states that have high COVID rates, like Florida, Arkansas, Louisiana, Mississippi, Texas. And so we know that those individuals are traveling around the country. It's just a matter of time, in my humble opinion, before we see a surge based on those states that we're absolutely watching right now. So don't sit back and be satisfied thinking, oh, I'm so glad I don't live in Louisiana, where they have absolutely run out of hospital beds. They've got people in hallways and people that they cannot even put in beds because they do not have the capacity. The other thing I would say is the healthcare workforce is really diminishing. When you look at some of those states, they cannot get the appropriate staff to work because of the burnout that we're seeing across the medical community. So I want to stop and thank the healthcare heroes one more time across the nation. And of course, our wonderful individuals in the city of Springfield. I will end with contact tracing, testing, and the 3 W's. And so contact tracing, we are still doing, and I thank so much the Department of Health and Human Services for all the work that they're doing to try and mitigate this. But we are still doing contact tracing. We ask you to be as forthcoming as you can with the contact tracers. That is still going on. We're still talking about isolation and quarantine. We are still asking you to do some of those very important mitigation efforts. And so we're back to COVID 101, aren't we? I'm back to asking you one more time to wash your hands, watch your distance, wear your mask. I'm back to March 2020. The difference, as the mayor said, is this time we have a vaccine. This time we have the ability to eradicate this virus. This time we can look back on COVID-19 like we look at polio and say, remember when? This time we have a way out. So I thank you. I thank you so much, Springfield residents. I'm so proud of you. That 43 to 45% of you that are fully vaccinated, I thank you and I appreciate you. Go out and tell your friends you got vaccinated, you want them to get vaccinated, because we do want to get through this together. Thank you.
Thank you, Helen, very much. Helen, here's your glasses. You're welcome. And again, thank you, Commissioner Helen Carlton Harris. This is not to alarm anybody. This is a preemptive strike. We're much better positioned to handle this, but we want to get the word out there that there is more light at the end of the tunnel. We don't want to go backwards, and I'm not insinuating that at all. Neither is Commissioner Helen Carlton Harris. What we're telling you to do, that it's an equation, and this plus this equals that. And what is that? The vaccination. To bring back, and again with Nancy Creed, the President of Chamber of Commerce here, to bring back full public, consumer, and business confidence, you got to get the shot. You got to get the shot. And it is proven that the vaccine works. And I just have to continue to ask you to look at the facts, the concrete information. Do not rely on some of the stuff that you are seeing on social media and these conspiracy theories. And Commissioner Helen Carlton Harris indicated very, very well when they talk about breakthrough. It's minuscule, minuscule. And when the vaccine was put across, 90-something% that it is doing. In Springfield, again, Commissioner Helen Carlton Harris has indicated to me the numbers uptick, and we're much well positioned in the state of Massachusetts. Governor Baker, Lieutenant Governor Polito, all have done a tremendous job. And compared to some of the other states that did not follow requirements, they're the ones facing the issues right now. They're unvaccinated. The ones who have caught this new variant are unvaccinated individuals. And it's the younger age group, average 35, it was prior 60, 18 to 35. So the vaccination opportunities are out there. We please ask you to get vaccinated. In the meantime, again, I just apologize, I just took my mask off. We recommend, strongly recommend, that you should be wearing your masks, especially if you have to wear your mask if you're unvaccinated. Underlying issues, and also when you're moving about, you really should think about interior or certain outside events that those masks should be worn. To the private business sector or private type things, please strongly look at those recommendations to keep your workforce safe and sound and preserve it, and keep the public safe and sound. But if we follow thank you. Thank you, folks, in Springfield, too, by the way. If we follow the recommendations, as we have done before, we will be able to... Public radio, but I give you a little more for your budget there, huh? Makes sense. If we follow the recommendations as we've done before, we worked hard. We've all worked very, very hard to get we're in a position to really get back to vibrancy. We will get there. We will get there. We took another shot now, pardon the pun, and we're telling you what needs to be done so you don't have to revert back 2 or 3 steps. We're going to continue to move forward. With that, I'm going to stop. I think enough has been said, and we'll take some questions, whether myself or Commissioner Helen Colton Harris. Leon?
Just a moment ago, the mayor of New York City, Bill de Blasio, was requiring vaccination for things like indoor dining, the gym, and indoor entertainment activities. At what point could this happen in Springfield?
Again, we will continue to monitor the situation, as I said before, and if the numbers, and I hope they don't, continue to uptick, then we were going to review all our options. We're going to work very closely with the business community, as I have before. We worked very closely with our business community. We've worked in lockstep with our medical community. Helen and I, with Dr. Kerouac at Bay State, Dr. Roos at Mercy, and we still do. And she mentioned Louisiana, some other places, other states where there's no more hospital space. We're in good shape on that. I'm hoping, Helen and I really are hoping that we don't have to make those moves. We're letting people know now, so they don't come back and say, why didn't you do something before? You know, when this all started, we were very proactive in making moves, the homeless population, other things that people questioned in the beginning, and after said, boy, you guys moved 2 or 3 months ahead of time on it. So that's what we're doing. We'll monitor the situation. I told you I would not be afraid when it comes to preserving and protecting my city workforce and or the public. And then we work in conjunction, obviously, with our medical professionals and our business community. The business community are pretty smart. They know how to handle things also. But our numbers were not in extreme shape, but as Helen said, we went from 17 to all of a sudden 117, 122. You got to start looking at that. So we want to nip this in the bud now. So I won't rule anything out, but we'll only, as we've done before, Leon, we will base our decisions balancing economics, economic development, the business aspect on the public health, medicine, and sciences. We're not at that point right now. If you do what the health professionals, such as Commissioner Helen Colton Harris and others have indicated, and what I'm advising you or strongly recommending you do, we won't even have to cross that bridge. We won't have to cross that bridge.
Mayor, can you tell us a little bit more about the decision to require masks in schools, which exceeds what the state of education officials put out?
This is in consultation with Superintendent Warwick and Chief Nurse Jeannie Clancy, who we met, spoke with yesterday, and I appreciate Superintendent Warwick says that Commissioner Colton Harris himself had importantly, when we went back to school, minuscule cases because of that. So no, and we've always gone, Helen and I and my whole team, cabinet heads down the rank and file, Pat said, we've gone, and we're doing that here so we're going to do that, and that'll go for students, and that'll go for teachers down. Then we can review that. But we want to go above and beyond. We want to make, and we got to get you come back to school, because we did a tremendous job remotely, but in educating and feeding above and beyond on that. I know Desi, and I think Springfield's been a trendsetter. We've done above and beyond, and I'm going to continue to do that in protection and preservation of our workforce and of the residents and business community of the city of Springfield. Okay. Any other questions? Leon?
And so you did a last presentation prior to when everyone went back to school. With parents having to come on to the side of the virtual. So can parents still sign up for the virtual academy in the fall, or is that not?
Well, I think Superintendent Warwick, they will address that. I know there were some deadlines on that, and we had the school committee was updated. It was our last meeting or the meeting before on the numbers that we had going to the virtual academy, but I will allow Superintendent Warwick to elaborate that on more. You can get information on their website pertaining to the virtual academy. I know there were some deadlines pertaining to the virtual, but I think, and for some parents, students, that works. For the majority, Got to get our kids back in school, and that's the way we're going to go.
It sounds like you are as well taking a very targeted approach to that. Do you feel like that's working? And what could some other steps be to encourage people to get vaccinated at this point?
I think, I'll let Helen speak too, which, people targeted the disparities that were occurring for our brown and black population. We specifically targeted that. Ebony, the preeminent African-American magazine in the nation, highlighted the Vax Force on it, created on our outreach efforts there. Here is the problem, here is the issue. It's the misinformation out there. Just this morning when I came in, I had, you can't mandate this, you can't do this, you can't do that. It's the misinformation out there. We've also used social influencers too to get to that younger population. Geez, Johnny Smith got the shot. I'm getting the shot too. So we're doing everything we want. We're giving stuff away. Charlie DeMore had called me a couple months ago, a month and a half ago. She want to help out. What can we do, Don? We're doing raffles. Anytime we do shit, we're doing raffles. And sometimes that coaxes people to get the shot. It's terrible you have to do that. Governor Baker has also done, and I'd love to hit it too for my young daughter's wife. She's done the Vax, the millions, scholarship stuff. So I just think the biggest impediment here, and I want Helen to speak on it, is the misinformation that is out there. And I just ask people, please, don't play politics with this. Pure and simple. The vaccine works, and this is about public health and common sense, not politics. Not politics, but I'm going to let Helen, misinformation, she can expand upon it.
Well, I think our strategy has changed. Originally, we were doing online appointments. Now is that we have to take it to the neighborhoods, which is exactly what's happening. So our strategy has reversed. We're having smaller clinics in neighborhoods, and as the mayor said, we have incentives. So anyone who comes and gets vaccinated now can get, through the Department of Health and Human Services, let me be specific, can get a $25 gift certificate from Stop and Shop, from Big Y, from Walgreens. And we recently did Bumpy's Organic Foods. And so we are understanding that maybe than in the past. So we're trying to combat that misinformation by going door to door and giving credible information. And again, asking individuals, particularly parents, do your research if you can. Get the right information to make the right decision. So we've had a shift in strategy.
Thank you. Any other questions or comments? Leon, yeah, go ahead.
So, just concerns about plans in Springfield in the near future, the rising COVID cases, the 10K practice coming out, concerts, indoor concerts, mass musical events, etc.
We're going to continue to monitor the Balancing Act. I want to make sure we keep the economy going, but I also want to protect public health. So that's why we're making this preemptive strike right now.
And how many updates on the number of COVID cases numbers this week at all? Do you have any numbers or from last week at all?
I'll leave that to Helen because they're reporting, the state is reporting differently now. I know in our, for about a year.
Are you looking for that 100, that number that I usually put up?
Yeah. What were the numbers last week and what were we at so far this week?
Oh, 19. So this week's number, and I was actually in the mayor's, let me start by saying what the mayor said, is that the state no longer reports. Today, I did get a number of 78. So we break that down to about 24 cases for each one of the 3 days, which is higher than we've experienced in the past. So about the numbers, and so he speaks with me daily around where our numbers are. I send them to, obviously, the mayor, but we are seeing those last 3 days numbers are higher than we've seen in some time.
This is all we continue to post. We've had a website for a long time now. Those numbers, constant information, update information is on there, and the numbers continue to be updated. Again, this is a preemptive strike. So we don't, Leon, the question you asked, good question, that you don't get to the point in time where all of a sudden we're taking 2 steps backwards. So I just think the biggest thing is The vaccine works. Shots in the arms, shots in the arms, shots in the arms. Please do not be fooled by the misinformation that is out there many a times on social media. And this conspiracy theory stuff is absolutely ridiculous. People have lost. We still have people that say there's no such thing as COVID-19. And I'll say, tell that to somebody who was seriously ill, or tell that to somebody who lost a cherished loved one. We all have family and friends who've lost their lives early on. We're not at that point. We're much better positioned overall with all the moves we made prior. And as Helen said, the ace in the hole is the vaccine. And we need to utilize that, and we need to continue to do that. Massachusetts has done a very, very good job. Governor Baker, Lieutenant Governor Cleveland, we've worked hand in hand. But as Helen said, we're a very mobile society and population. People travel. People travel. So this is not to alarm at all. Not too long ago, Helen was indicating we were getting 17 for the whole week. Now all of a sudden we're back into triple digits. Everything handled, hospitals, everything's good. But why get to the point in time, and we don't want to, where things, no preventative stuff is done? And I think, in a way, people are tired, they're aggravated, celebratory that there's light at the end of the tunnel. We let our guard down a little bit too. And the virus has changed, different variant with the Delta virus, which is Commissioner Helen Carlton-Harris indicated, spreads much more quickly and has different symptoms than the COVID-19 coronavirus. Remember we said the temperature checks, that doesn't come into play anymore now. So that's what we want to do. And again, I ask our viewing public, and especially my residents and business community of the city of Springfield, you've hung in there. You continue to work with us and do the right thing. We still have that percentage that do not want to do the right thing. Now, if you have a legitimate and proven medical type situation and or religious type situation, exemptions, I get that. We respect that. But why would you want to put yourself, your family members, your co-workers, friends in harm's way? So I'm urging you to get vaccinated. It is pretty simple to get it done. I'm going to continue to make moves to preserve and protect my city, our city workforce, and the public. And with employees, I asked all my cabinet heads and department heads. I see my HR labor director, Bill Mahoney's here. We're getting an update on where we stand on employees being vaccinated. Some have done very well. Others, I want an update on the situation. And if the numbers continue to uptick, you could see stronger or orders coming out as far as a requirement of employment. I don't want to get to that point in time. But again, it's everything that we're considering doing is to preserve and protect our city workforce and the public, and we want to work hand in hand with our business community. I want to balance keeping the economy going, but we had a proven formula before that's helped us fly the plane as we were building it. We were shadow boxing. You got to remember, this administration, my administration, the cabinet heads, many of them in rank and file, have been tested and true. We've been through a number of natural and man-made disasters and been able to tell people the three important things. What happened, what we're going to do about it, and just as important, the hope. We're going to get through this together. So please, again, I urge you, please get vaccinated. In the meantime, protect yourself with following all the public health requirements. Wash your hands, distancing if you have to do that. You're going to have to get back to certain times. You're going to have to get back to wearing those masks, especially if you're unvaccinated And don't ostracize anybody who's wearing a mask either. They might have underlying situations going. That's another thing there too. Don't play politics with this. It's about public health, and it's about common sense for the good of the community. So that's where we stand on it, and hopefully next time Helen and I come before you, we'll be giving even an improved update. But we just want a preemptive strike. We don't want to alarm anybody, but we need to make some moves right now. So we nip this in the bud. I don't know if Helen has anything else or any other questions or comments.
Real quick, Mayor, just to clarify the policy for unvaccinated city employees, right now it's masks and testing.
You get masks. You're going to have masks. I'm getting an update on to see who has not been vaccinated. And if you're still unvaccinated without a legitimate medical exemption or religious exemption, then you're going to work with Helen. We have our own staff, and we have AMR. AMR has been a great partner. We will do testing, and that testing will be frequent testing. Again, we work so hard to preserve and protect our city workforce and our public. We never shut City Hall down, unlike many other surrounding communities, some which are still shut down. We always kept it open. It was via appointment and all the check bases that we had to do, and we're open fully now. But now we're requiring unvaxxed to get a mask, and you're going to have to wear a mask when you're in here indoor, and you should think about it when you're doing some other activities. I think some businesses, and again, Nancy Creed, the Springfield Chamber Commerce President, is here. Some businesses are already making moves on their own. Commerce still continues, don't get me wrong, but they're making moves on their own, which is good. So just please don't believe these conspiracy theories, and please do not play politics with it. It's just that will not finally starve this COVID-19 or any or different variants, such as the Delta variant, which has come out now. So those are the moves we're going to make. If the numbers change, and hopefully they change for the good, hey, that's great. If they change, continue to be a challenge, Helen and I, and working with the medical field and my other cabinet heads, will make other subsequent moves if we have to. Okay, thank you very much.
Thank you, Mayor.
Thank you.
Commissioner.
Thanks, folks, Springfield.